Hi, everyone. Joe Glaviano. I'm the program coordinator with Aurora Health Alliance. Thanks so much for being here today, and thank you to our speakers. As you can see on the slide, I'll go ahead and just read the slide just in case if you're on the phone and can't quite see it. We have three speakers. Our first speaker, Nancy, will be talking about the Community Connections campaign with the Resident Leadership Council. And then Nicholas Marquez from Hunger Free Colorado will be talking about the Healthy School Meals for All. And then we have Rebecca Rapport with Tri-County Health Department speaking about the new OmniSalud program and website, as well as Update Your Address campaign in preparation for the end of the public health emergency. So I will go ahead and introduce Nancy Fitzgerald, who will start as our first Did You Know speaker. And Nancy, I'll let you take it away. We have your slides for you, so you can just let us know when you want us to move on to the next slide.
Thanks, Joe. And I'm also going to introduce Gabriela Jacobo, who is leading the work with the Resident Leadership Council. So Gabriela, I'll let you take us off.
Hi, everybody. Thank you so much. So we've shared this information a little bit more, expanded a little bit more last time that we were with you. This time we wanted to give you a really quick brief about the Resident Leadership Council's connection campaign. The Resident Leadership Council started way back in the fall of 2014, and a little bit before that, in 2013, the University of Colorado established an initiative, the CCP, some of you might remember, that would focus on developing its anchor mission. And one of the main goals was to build that bridge of communication between institutions at the medical campus and with community members in communities surrounding the medical campus. We promoted this and went out into the community with the efforts of making those connections specifically to introduce community members and groups to the institutions. As I mentioned, by the fall of 2014, we had already connected with many community members, and 10 of those I asked if they would be willing to be part of the RLC, Resident Leadership Council, which they all accepted. They all came with a wide community network. That means that they were involved in talking to many neighbors or organizations, and we were happy about that. The Resident Leadership Council is a grassroots community group, still up until this point, working in alliance with CU and being the voice for residents who live in communities around the Angeles Medical Campus. We work, and specifically, we work and concentrate on supporting and working with our immigrant community and all underserved. We now have 27 community members participating in the RLC, and this includes young professionals, congregational leaders, and parents from our Aurora Public Schools. Very cultural diverse group with the gift of many languages, and that's the way that we are able to develop successful connection campaigns where our resident RLC leaders go out and meet on a one-to-one with other neighbors in their community networks. Our model, next slide. Oh, first, I'm going to share the mission for our RLC. We build relationships by empowering local leaders, advocating to preserve the diversity of community and using its values to improve quality of life for our families and neighbors. In our vision of the RLC, we envision an informed community through equitable access to quality schools, health resources, and sustainable careers that will boost economic development. And the model that we have followed since it started back in the fall of 2014, where the institutions, and this in back then it was Children's, UC Health, University of Colorado, and right now continues to make an effort. It's the University of Colorado, but we're always welcome to collaborate with anybody who wants to join. So the university reaching out to our neighbors, but not only our neighbors, but being very intentional, knowing that there's many organizations that have the experience and the connections with families in Aurora and other surrounding neighborhoods. And we make it that our main goal, that not only the institutions are connecting, but once we establish the RLC, that the RLC is introduced to different groups, different partners at the medical campus, and as well as different collaborators in the community. And with some of you, we already have worked. And if not, please let us know, and we will be happy to introduce the work of the RLC. What our main goal is to build relationships. The community has asked for this, that the unity of community builds a strong power for us all together to overcome challenges. And Nancy's going to talk to you about the Connection Campaign. This latest challenge, that we all went through, which was COVID, and the outcomes of this crisis. So we build this, build relationships, because our main goal is to thrive, having neighbors that live in healthy communities and are able to build wealth. Next slide, Nancy.
Thanks, Gabby. So I'll talk a little bit about the most recent Connection campaign and what the RLC has been doing since that time. So like Gabriela shared, in a Connection campaign, the Resident Leadership Council members will go out and meet with people in their networks. So people at their congregation, people in their schools, at work, at food banks that they volunteer, and build relationships is the main goal for these campaigns. And then also we want to hear about what is going on with families. What are people's hopes and aspirations? What are people's concerns? How has COVID impacted families was a big one for this campaign. And then also what kind of changes do people want to see in the community? And so based on that information, it kind of guides the work that the RLC does for the rest of the year. So you can see this is a map of where one-to-one conversations took place. Most of the conversations were centered in the 800, 1011, and 12 zip codes. This has historically been where the RLC has been really focused in the work. And it's expanded in this last campaign compared to the others, because of people moving for job opportunities, or because families are displaced with the housing that we've had over the last year. And so here's the map of where these conversations took place. The topics that came up the most as the areas of highest importance, one was safety and gun violence, especially centered around the schools, the APS schools in North Aurora and these zip codes. If you remember, so this Connection campaign took place in the fall / winter of 2021. And there were several incidents of gun violence taking place at that time in and around the APS schools in North Aurora. And so that was really a big topic that came up. How are we going to keep our kids safe? How are we going to know that if you walk down the street, you're not going to be in danger? How are we going to solve this problem? And then another thing that came up was the mental health impacts of the gun violence issues. And so how are the students being impacted by these issues? How are the students afraid to go to school and worried that something's going to happen to them, or parents are worried about what kind of phone call they're going to get? So that was another big issue that came up. And then people also talked a lot about healthcare, access to healthcare. How do you know, if you're having a problem, where can you go? How do you get health insurance? How do you get affordable health insurance? And for people who are not documented, where are you supposed to go for healthcare? And so those were the three things that really came up a lot in this connection campaign and that have driven the work since then. So if you'll go to the next slide, Mandy. Since this year 2022, we've been holding community meetings throughout the spring to discuss some of these issues that came up and connect members of the RLC as well as the community who participated in the connection campaign with the officials, the representatives, the experts on these topics. So we had monthly community meetings throughout the spring to provide opportunities for people to share their stories, to ask questions, to have dialogue with the people who are involved in these systems. So Aurora Police Department, Aurora Public School Systems, all of these systems that are involved in these issues. And based out of these community meetings, we call learning sessions, because a lot of it is about learning how to navigate systems and institutions. We realized that we really need to take a couple of these issues and take a deeper look. And so out of that, we have developed community academies throughout the fall. And you can see the different community academies that we've done in August, focusing on public safety, in September, focusing on youth mental health, and then upcoming this next Saturday, focused on the healthcare system. And we've been very fortunate to have fantastic collaborators on these academies, people working with us to be able to present information, present resources, to share so that the RLC will have these resources and then be able to share that back with their network. And then also to inform how the work will go forward. Now that we have all of this information, what are we going to do next? What are we going to do with it? Will be the next steps for the RLC. Gabby, anything that I missed?
Nothing, just like you mentioned, at the end, after like Saturday's our last community academy, we go from 8:30 to 12:30 and we're at 1550 Havana Street for those that want to join. The attendance has been amazing. We've had over 50 to 60 community members come to every single of the community academies. Talking about August, that was a 2-day community academy and was very well attended. Community members are eager to establish the conversation with those decision makers, with leadership. And then now that we have, that we're going to complete on Saturday, we're going to complete our learning sessions and community academies. We will move on to the planning part where we're inviting all RLC to meet every 2 weeks, because we're going to analyze the information learned throughout from February up until October. And in January, we will be planning a large community meeting to bring the results of the learnings and inviting those who have been involved in our learning sessions for public testimony, and as well in our community academies. So we are more than happy to see you. We're hoping to see you on October 22nd. If not, we will come and continue to keep you updated. That is our brief update for today.
Hey, Gabriela, this is Rich.
Yes, sir. How are you?
Good. Gabriela and I go way back to the beginning of the Community Campus Partnership, and we always envisioned the RLC to really be a key component of the Anschutz campus, of its anchor mission. And it's so wonderful to see these community academies coming up. The one on healthcare certainly is highly relevant to everyone, I think, here, as are the other ones. Now, Gabriela and I are Catholic, and I think within the Aurora community, the two major community groups that engage with real people. When I say real people, it's just regular people, not necessarily professionals and so forth, are the schools and our Catholic churches. So, Gabriela, has the RLC had much luck in getting into and promoting RLC and the events at the major Catholic churches. And there are three major ones, actually in 80010, 8011, and 12. That's St. Therese, Queen of Peace, and St. Pius X. Any luck in doing that and in getting something going with those churches?
So we are very intentional on approaching, our congregations and the surrounding communities. Not necessarily we do it like a pulpit announcement, but we have community members in our RLC that represent those parishes, and we're very intentional on making the invitation. So not in large numbers that we can say, 5 to 15 to a dozen community members are coming directly from this parish or this congregation. But we know that if we ask at the end of our community academies in our evaluation sheet who they represent, we would make sure that we will see many of those parishes and the congregations from our congregational leaders that participate actively in the RLC. So in few words, yes, we are, and we are doing it through our RLC. So we know that we have community members coming from Ascension and from Queen of Peace. Not sure about St. Therese, to be honest, because our RLC members that are from St. Therese are right now working on weekends. So we know that even if they make the invitation, it's not as strong when they're actively attending the sessions. But we've had them in the past, and we know that we will continue to have them. So yes, we are very, very intentional to make that invitation, because we know that a lot of our community members, not only from our Catholic Christian faith, are coming to sit down and have an open dialogue, but especially from also our Asian, African communities, specifically from the refugee. Now we're having, from other from temples or other congregations willing to sit down with us and have those public testimonies and listening to our community academies.
Thanks for the update, God.
Thank you.
Gabriela and Nancy, thank you so much. Any other questions?
Are other organizations able to collaborate with you to work with community and get feedback to guide community work more directly?
We cannot do the work alone. The university does not have all the tools and resources to build the amazing community engagement work that we've developed through the Resident Leadership Council. We depend on collaborators, and we've been amazingly lucky to attract amazing collaborators right from the start. We have a history, and I believe it was included in the long presentation that we did last time for this group, where we presented a slide with key collaborators, and it's very long and I am not able to mention them all, but they are not only putting in possibly funding resources, but those that are very connected with community and that are willing to support other community members like the ROC. They put in hours and effort. So our learning sessions are based on collaborators, and then we of course make new ones. So yes, our work is based on collaborators, and we have many of those that are very intentional on supporting Resident Leadership Council in the work, of course.
A question came through: how can we as Alliance members work to raise the success of the Resident Leadership Council?
Oh my goodness, that's like the most amazing question that I love that question. Who made that question? Yes, there is throughout since February that we started our bi-weekly learning sessions. We came back after the Connection campaign. We came back with an urgency to hear community members do public testimony to this list of representatives that we have right here, actually, and more, city council, our Board of Education and others. Since then, we've been trying to attract more collaborators. Again, like I said, our success and the success of our work moving forward is based on how do we promote this work? Who do we introduce this work with? And then who is out there with the tools that they say, you know what, this is my gift and I wanted to make it available to the Resident Leadership Council. And it's as little as, maybe presenting to the RLC. We have just Aurora Health Alliance have all these amazing participants where are either from UC Health or from other medical institutions. And we're always seeking our experts and our leaders to come and present to our community members. All our work is based on learning. That's why we call them learning sessions and community academies, because in order for our community members to unite and take action, first they have to learn. And they're so eager because they want to find solutions to the problems that they're facing. So if you think that you have tools, gifts, expertise, and are interested in supporting, especially this main issues that we're targeting right now for our January community meeting, please contact us.
Specifically, especially for those issues of safety, gun violence, and youth mental health. If you have resources, connections, ideas of how to make substantial change in these issues and in interacting with the institutions that are involved in these issues, like APD, APS, we would love to hear about that and have the opportunity to work together.
Yes.
Sounds wonderful. I can already, I can see Mandy's brain turning with connections. And so it's going to happen. So thank you so much. That's really exciting. And thank you for the work that you're doing.
Thank you.
Great.
Thank you so much for the space.
Yes, absolutely. Anytime. All right. So we're going to move on to our next Did You Know speaker, Nicholas Marquez with Hunger Free Colorado.
Nicolas Marquez. I'm a community organizer with Hunger Free Colorado. I just wanted to start off by thanking you all for being here and for the invite. I think this is great. So it's Healthy School Meals for All, or FF, on the ballot, you'll see. And I'll start off with a little bit of context. This basically came about, the last 2 years of the pandemic. There was a similar program, right? Every kid was able to eat lunch, what have you. But that's since expired. So we started out with the bill at the Capitol. It lost momentum for various reasons, but we were able to get it to pass through as a referred measure. So that's how we find ourselves on the ballot today. So for those of you who don't know or need a refresher, what have you, FF is to basically do the same as the federal program before, and that's to make the school meals completely free. So families, parents won't have to apply and be approved for free or reduced lunch. This is an attempt to just strip away all the barriers, but at the same time keep it healthy, because of course we've heard and maybe you've experienced yourself with your own child or what have you, the meals right now aren't very healthy, very sugary, salty, and highly processed. So we're looking to strip that away as well. Which brings me to this point. There is grant funding available to participating districts that buy locally procured foods. So that's one part of paying for it, right? And it's a good way to hold them accountable to make sure that these meals are healthy, right, for the kids, which is a big deal. And this, again, with those reimbursements, that's a large part of paying for this program. The other portion of it is reducing or limiting tax deductions, state income tax deductions for people that make over $300,000 a year. which is about 3 to 5%, I believe it was, of our population here in the state. So it goes for a good cause, right? And it doesn't affect your average Joe, if you will, which is good. This is another reason why I'm a great supporter of this. It also includes grants that are available, TA grants to help provide better training for cafeteria workers. Obviously, if we're bringing in fresh produce, they have to have the wherewithal to be able to handle that produce, how to care for it and so forth, but also how to cook it. And they could also this can also help provide better equipment for them as well. So this is really a holistic approach to trying to combat these issues we see in regards to school lunches. Another main aspect of this is we want to make sure there's an advisory committee of parents, so they have voice in the types of foods that are being served to their kids. So I think that's pretty special as well. And I don't believe any other program that's official, at least. There may be some pilot programs out there, but this would be one of the first ones to actually, make that available to schools and parents that are looking to participate. You probably experienced, again, maybe there's dietary restrictions for your young one, right? They can't eat dairy, so forth. This would help combat those issues, right? Yeah, I'll stop there. I know this was more than 3 slides. I appreciate your patience. But I try to go through them as fast as possible. I'll stop there and I'll answer any questions. And then maybe I could comment on what we're doing to engage voters from here till November 8th.
I would be curious to hear about how you're engaging voters. Go ahead and tell us and how we can support you too, in the work you do.
Yes. So starting October 1st, we kicked off our days of action. So since then, every Saturday, we've been meeting at a park throughout the metro area. The last one was at North Glen High School. And we just canvassed the area. It's pretty fun. We make yard signs available to folks. We have bagels and coffee and lunch, depending on the shift you sign up for. But it's really just meant to be a community-driven, right, event and to engage voters, our neighbors. So it's pretty fun. I'd encourage you all to hopefully sign up for some. If not, there are social media toolkits that we have available. If you're interested in that, I could share that out as well. In fact, I'll share all this out because for the days of action, we are having people register, which is just helpful for us to order the right amount of bagels and make sure we have enough of everything, right? Packets of doors, to canvas and whatnot. So, and aside from that, I mean, I'm doing a number of these types of presentations. The Colorado Statewide Parent Coalition, they had a group gathering yesterday of parents who have special needs children, and I did a presentation for them. And really the ask is similar, just to help pass on the word. That's the biggest thing right now. So if you know of any other groups I should be presenting to, let me know.
What are some things that you're hearing in the community or the work you're doing around folks who are against the measure?
Well, aside from them trying to say that it's, and this isn't really largely what we heard, but a lot of people see tax increase and scares them all away, and they don't read that 3rd or 4th line, whatever it is, that entails it only affects a certain amount of folks. Aside from that, people would say, why should we pay for lunch that for kids that could afford it? But it's very difficult. Even people that can quote unquote afford it are struggling financially. And that's something we've heard throughout our story collection in this campaign. The average breakfast and lunch is about $3, $3.50. And so if you put that in terms of 2 children, right, that could be $12 a day, $5 a week, or 5 days a week, right? So it all adds up and it's very expensive. So, I mean, that's one way to kind of combat that, right? But that's really what we've been hearing. At the doors, it's actually refreshing to know that once you mention it's school lunches, people's ears perk up and they listen, especially when I think it is to be to qualify for free or reduced lunch for a family of 3. I think the threshold is like is below 35,000 and below, which we all know you can't survive off that. So.
And then the other thing, Nicholas, you had mentioned the nutritional meals. I've seen some of the meals that are out there and they're not very nutritious. Yeah, well, the emphasis of this program to really provide nutritious meals with a balance of carbohydrates and protein that kids need.
Yeah, that's the intent. You know, they it's when you bring in fresh produce, I would say it's, you know, obviously a little bit more difficult to make it unhealthy, and we're hoping that you know that helps discourage anything like that. So I would say, yeah, that's our intent for sure with it. And again, a big part of paying for this program is the reimbursements they get buying those fresh products. So as far as what the meals will look like, who's going to do the menu building, I'd hope those committees I mentioned also would have a say in that, and you know, hopefully bring a healthier balance for sure.
Great. Thank you so much. Thank you for all the questions. Thank you, Nicholas, so much. All right. Our next Did You Know speaker is Rebecca Rapport from Tri-County Health Department. And Rebecca, I'll let you go ahead and share your screen if you like.
Awesome. Thank you, Joe. Hi, everyone. My name is Rebecca Rapport. I work with Tri-County Health Department with our health enrollment team. I'm here to talk about a couple updates related to health coverage. So I'm going to go ahead and get my slides going. So I am here to talk about a couple updates related to health coverage. I think there's quite a few people on this meeting right now who probably could give this presentation. So I'm just going to do my best and I look forward to your questions. So there's 3 things that I want you to remember today. I know Nancy mentioned during her presentation with Gabriela that people are really struggling to understand what their options are for health coverage and how to get health coverage. So one of the things I want you to remember when we're done here today is that there are many different ways to get health coverage. The best coverage is going to depend on your individual situation. And there are resources and there are real people to help you or the clients that you serve navigate selecting and enrolling in health coverage. The second thing I want you to remember is that open enrollment for the Connect for Health Colorado Marketplace begins on Tuesday, November 1st. And there's a few exciting updates that will expand coverage, and we're going to talk about those. And then the last thing I want you to remember is that individuals with Medicaid or CHP should remember to keep their contact information up to date in state systems to avoid a gap in coverage at the end of the public health emergency. And I'll elaborate on that a little bit too. So just a really brief overview of how people get health coverage. This is a graph put together by the Colorado Health Institute, and it shows sort of over time how the ways in which people get health coverage has changed. I know it's pretty small on this screen, and I'll send out these slides after through Joe and Mandy, but just to sort of give some perspective, the 2021 is the latest data that we're looking at. That's the top bar on your screen. You'll see about half of the people in Colorado are covered by that purple bar. That's employer-sponsored insurance. So I know quite a few people on this call represent organizations where oftentimes those organizations pay a little bit of your health insurance, and then you as the individual employee pay some, and that's how you get your health insurance. And they probably have 1 to 5 plans that you can select from. The dark blue bar on here is Medicaid. And you'll see over time between 2013 and 2015, there was a big jump, almost double the number of people enrolled in Medicaid in Colorado. That's when Medicaid expansion was rolled out by the Affordable Care Act. And then you'll see also between 2019 and 2021, a big jump in the amount of people, the percentage of people enrolled in Medicaid in Colorado. Obviously, you probably all remember 2020 was the beginning of the COVID-19 pandemic here in the United States. Many people lost their jobs and they became eligible for Medicaid, enrolled in Medicaid, and have maintained that Medicaid coverage ever since under a provision called the Federal Public Health Emergency, which has kept people covered by Medicaid regardless of any changes in their life. So even if they now are employed and they have the option to get employer-sponsored insurance, they are still technically covered under Medicaid. The gray on here shows people who are enrolled in the individual insurance marketplace, and we'll talk more about the marketplace. And then the red section on here is people who are going without insurance in the state of Colorado, either by choice or because they're not eligible. So just a very brief little overview of some of the different public health coverage plans that we'll talk more about today. So this is not employer insurance, this is not Medicare for people over 65, but kind of those main public coverage programs that maybe you or your friends and family or the clients that you serve are enrolled in. The first one is Medicaid. In Colorado, we call it Health First Colorado. So this is free or low cost health coverage for people under a certain income limit. Right now, to enroll in Medicaid, in general, you must be a Colorado resident, a lawfully present child or pregnant woman, or an adult within certain income requirements. Medicaid covers many, many, many benefits with low to no copays. It is a great coverage plan. It can have a little bit more of a limited provider network, but it is a great option for people. The Child Health Plan Plus is similar to Medicaid. It has copays often that are more than Medicaid. So it is for pregnant women and children to get coverage if their families make too much to qualify for Medicaid, but maybe don't have employer-sponsored health coverage or the coverage is not sufficient to cover their family. And then Connect for Health Colorado was that, if you can recall that gray bar on the previous slide showing individual insurance, those are people who are covered by Connect for Health Colorado. So this is the state-based marketplace to shop for health insurance plans. It is the only place to get financial assistance for those plans. So you could go directly to an insurance carrier. So for example, Anthem or Blue Cross Blue Shield or Rocky Mountain Health Plans or Kaiser, and buy your plan directly from them. But if you're interested in financial assistance, the best place to go is to shop through the marketplace portal, which is called Connect for Health Colorado here in Colorado. It does not have any income requirements. The amount of financial assistance you get will be based on your income. And all plans are required to cover essential health benefits. So they cover all the things that are technically supposed to be covered. They are great plans and they're not just sort of piecemeal, they're pretty comprehensive. And vision and dental are separate plans to enroll in. So the thing I want everyone to remember today is that open enrollment into those marketplace plans will begin on November 1st. So this is for customers who are newly eligible to enter the marketplace or who have Connect for Health Colorado coverage right now. They have the opportunity to renew or select a new plan. We always encourage customers who have had a Connect for Health plan in the past to come in, meet with us and talk about their plan and make sure that what they're going to renew for is really the best plan for them. The plans can change a little bit year to year. So it's really important to look at the details of what a plan covers. Does it cover any medications that you take? Does it cover the nearest hospital to you? Does it cover your doctor or a specialist that you might need to go to? Right now for the Connect for Health Colorado marketplace, you must be a Colorado resident, you must be over income for Medicaid, and you can have employer-sponsored health insurance. That's actually a mistake on this slide that I didn't correct, but you are not eligible for financial assistance if you have employer-sponsored health insurance. I do want to note that you may have heard that under the American Rescue Plan, many people were eligible for a $0 monthly premium with a Connect for Health Colorado marketplace plan. So depending on your income level, the monthly premium could be $0, similar to Medicaid or CHP. That is remaining in place for this year. So you or your friends or family or your clients may be eligible for a $0 monthly premium under Connect for Health. So who are we sort of talking about when we're talking about the group eligible for Connect for Health? I think it's helpful to give a couple examples. This might be somebody who is an independent consultant and works for themselves. This might be somebody who operates or works for a small business, such as a local small family-run grocery store or another business like that, or a small restaurant, where they're not big enough to be required to provide health insurance to employees, but it is really critical for people to get health insurance so that they have coverage if something bad does happen. We're really lucky here in Colorado. We have caps on the amount that you can pay out of pocket. So I think in the coming year for an individual person, that would be, I think it's going to be $9,100. It's a lot of money, but the average hospital bill for an accident, like a broken leg, could easily be $20,000 to $50,000. So just thinking about sort of what health insurance will cover and pick up should you have something unfortunately bad happen. So a couple big changes I want to note for the upcoming open enrollment. The first is that this year, all carriers in the marketplace, so all those big companies, Kaiser, United, Anthem, are going to offer a standardized plan. This means that they will all offer, I'll try to get this right, a plan in each metal tier. So a bronze plan, a gold plan, a silver plan, with the same benefits. So all these plans have been designed under a program called the Colorado Option. The Colorado Option has focused on creating consistency across all the plans so that it's easier to make a choice and you know you're going to be getting a good set of benefits when you enroll in the plan. What's going to be different is the medications that they cover or the providers that they cover or the hospitals in their network. That's what's going to be different, but the benefits themselves across metal tiers will be the same across different carriers. I'm going to put some links in the chat when I'm done talking so that you can get more information about all of this. So that is one big change coming to the marketplace this year. The second one kind of dovetails off of that. There's going to be a new platform not in the Connect for Health Colorado marketplace, but managed by the Connect for Health Colorado marketplace called Colorado Connect. This is going to be a place for people to shop for health insurance regardless of their immigration status. So if they do not have documentation or they are a DACA recipient, they can get access to a health insurance plan from a health insurance carrier with financial assistance if they qualify. This is the first time ever that people without documentation are going to be eligible for this type of coverage with financial assistance. And the program that's sort of running the outreach related to Colorado Connect is called OmniSalud. So this is like, it's a little bit confusing. Colorado Connect is the platform that people will use to enroll. It is separate from Connect for Health Colorado. And the reason for that is to really keep people's information private and confidential. OmniSalud is the program that's doing the outreach around Colorado Connect. All of the Colorado Option plans that I just mentioned with that standardized set of benefits are going to be available in both Connect for Health Colorado and the Colorado Connect shopping platform. So regardless of a customer's documentation status, they're going to be eligible for the same set of benefits with or without financial assistance. This is really small. This is another thing I'll put a link to in the chat, but this sort of outlines some of the big benefits of the Colorado Option plans. One of them that I really want to call out is this emphasis on inclusive care. So they did a lot of listening sessions with providers and community members, and many people expressed the need for better health equity in our care. So one example is that now they have requirements around for plans to include better language access and access to different languages when receiving services that would be included in those Colorado Option plans. The OmniSalud program, this is just a little bit more information about it, basically saying if somebody is under 150% of the federal poverty level, they will be eligible for the OmniSalud plans in the Colorado Connect platform. Over that, they will qualify for a full price plan. Enrollment into OmniSalud begins the same day as open enrollment into the marketplace. That is November 1st, 2022, so in about 2 weeks, and coverage will start on January 1st. If somebody has this is a common question. If somebody has emergency Medicaid now, they can still enroll in OmniSalud. And they can have both types of coverage. So the Medicaid will sort of be there to cover any of those life or limb threatening emergencies, catastrophic costs, and they can still get OmniSalud coverage for ongoing preventative care, specialty services, things like that. There are only 10,000 spots available this year for the OmniSalud program across the state of Colorado. So if you or your clients are interested, we do really encourage you to sign up soon to get an appointment for enrollment assistance. This is just a note about the privacy and confidentiality of Colorado Connect. I won't read through it, it's on their website, but just to sort of explain, with the OmniSalud program, people will not be asked about their immigration status. Their information is stored with Colorado Connect, which is a privately owned database. It's not run by the state and it's not run by the federal government. The reason they have a separate platform is to really keep that information private and confidential. So it cannot be used for immigration enforcement, and it doesn't count as part of the public charge. So in terms of getting help with that application, I mentioned all the open enrollment will start November 1st. I put a link in the slides, and I'll share it in the chat also, to the Find Help scheduling tool. That's the best way to find an assister in your area to help with the application. I will note that the Colorado Connect shopping portal for OmniSalud is only available in English right now. So most people who are going to be using it will need assistance from a local site to help them complete that application. Hopefully that will change, but that's the setup right now. So I listed on here a couple of the organizations serving the Aurora area. All of these, I believe, have both in-person and Zoom appointments. And then a couple other partners I listed down here who are maybe not right in Aurora, but nearby, also providing Zoom or in-person appointments for assistance with open enrollment and all types of different plans. And I'll put that link in the chat. I can see some questions coming in the chat. Let me take a look. Okay, I think we're good. Let's see here. So I also have a link here to what's called the Quick Cost and Plan Finder. I'm not going to demo it right now, but if you're interested in looking at marketplace plans and comparing them, this is a great tool. The 2023 plan information is not in here yet, but it will be by or before November 1st to compare plans. I can show it if people have a lot of questions. Really quickly, changing gears, I want to talk very briefly about the public health emergency and Medicaid renewals. So many of you probably know that the federal public health emergency began back in 2020. That was that provision that I mentioned earlier about people having continuous coverage throughout the COVID-19 pandemic as it was declared a federal public health emergency, even if they have a change to their life circumstances. We do not know when the public health emergency is going to end. We think it will be January of 2023, but we really do not know. When it does end, there will be a rolling deadline for people to complete their renewal paperwork for Medicaid, or they will be losing their coverage and they'll need to either re-enroll in Medicaid if they're still eligible, get employer insurance if they don't have it already, or enroll in a Connect for Health Colorado marketplace plan. Those are kind of your options when the public health emergency does end. People have already started to get their renewal paperwork. That started, I think, back in March, May. So people are getting their renewal paperwork now. Completing that renewal paperwork now is what will help people keep their coverage into the new year when the federal public health emergency does end. So if somebody has Medicaid, make sure that they're keeping their address up to date. The way that they can do that is by contacting an assistance site like Tri-County or some of the other sites that I have seen share their information in the chat. They can also use Colorado Peak, the web portal, to keep their address up to date. Renewals are all sent by mail or by Peak. So that's really the best way to make sure that you get that paperwork. When somebody gets that renewal form, it's important that they review it. Even if they have no changes, sign it and either sign it in Peak electronically or send it back to their county office. Those forms cannot be processed at assistance sites like a clinic or like Tri-County. They have to be brought to the county to be processed. And if someone loses their coverage, they can enroll in Connect for Health Colorado. This is the contact information for the Tri-County Health Enrollment Team. You can give us a call. I've got a link directly to schedule with our team for open enrollment, or you can use that find help assistance scheduler tool. We're in there as well. We help with a lot of different types of troubleshooting around Medicaid, PEAK, or Medicaid, CHP, Connect for Health. So we are here to help. I'm sure many of you know that Tri-County will be dissolving at the end of the calendar year. This team specifically will be moving to Adams County. We will continue to really place an emphasis on serving the Aurora area, and I do want to share that here. We are a new Connect for Health Assistance site this year, and we were lucky enough to get a ton of support and training from Connect Aurora and Allison Somerton, who I know many of you know, and Sarah Maru, who was a longtime staff person of Connect Aurora, has joined our team now, and so we are really committed to continuing to provide services in this area, and are welcome to any ideas that you have about how we can do that as we move to Adams County. So I do want to also add that our team members are available to provide assistance in English, Spanish, Amharic, and Arabic. So we do have that option available, but we really just want you to go anywhere to make sure that customers get enrolled for the upcoming open enrollment. It can be with Tri-County, or it can be at any of the other amazing assistance sites in the area. So that is all I've got. I do at the end of my slides have like the income guidelines for Medicaid and CHIP and Connect for Health financial assistance, as well as some resources about how to understand and navigate health insurance. So hopefully Joe and Mandy and Bobby Joe, we can get those out to the group as well.
This is the first I've heard that that assistance can go to undocumented people, beginning with this open enrollment. But as you've said, it's limited to 10,000 for this open enrollment. Is the plan for next open enrollment, 2023, 2024, to be more open?
That's a great question, Rich, and one that I am not I think that is the
Hey,
plan.
this is Jessica. I'm with Connect for Health.
Oh.
I back you up, Rebecca.
Please, Jess, I would love for you to answer this
Thank
question
you.
as
You
well
did
as
so
many
good.
others.
You did so good. Thank you for presenting on this. And I do want to add that we're scheduled for the next Health Alliance meeting to talk more in depth specifically about OmniSalud. Those 10,000 spots are for the financially assisted plan. So for those silver enhanced savings for the folks who are under 150%. And yes, we are in the talks to have the cap evaporated for the next coverage year. And we also don't anticipate all 10,000 spots to be met during this open enrollment. The folks who are not financially assisted, or if they are under 150%, and the 10,000 spots they do fill up, the Colorado option plan will be still available for those folks to purchase. Unfortunately, the DOI has not put out any rates yet. So we're twiddling our thumbs to see how much that premium is going to cost those folks. But I will know by the time I present on OmniSalud.
I'd like to just mention a question that came through the chat and then uplift a few of the comments. There was a question, how does this work with those experiencing homelessness who do not have an address? I think that's in regards to the update your address piece.
Yeah, Molly, that's such a good question, and it's a really challenging one. If there's any providers on the call who serve people experiencing homelessness primarily, I would love to hear your perspective on this. For Medicaid enrollment, we encourage people to use a county human services office, or if there is a local community-based organization that they frequently go to, such as Aurora Mental Health Center or a day center, they can use that as their address and the mail can be delivered there. Obviously, that's easily said in practice or easily said and much more difficult in practice, where people are often moving around from place to place and don't go to check for mail. So PEAK is, if someone has a smartphone or they have access to a computer, PEAK can be an option for them. Again, that's going to be really dependent on the individual.
Rebecca, what really jumped out at me in the earlier part of your PowerPoint was the decrease in the uninsured from 2013, 2015 till today. So we've had 7 years really of what, maybe 6, 7% uninsured. Back in the early days of the Aurora Health Alliance and for decades before, that number was like 15% or more people uninsured. So this is just, I'm going to throw this out. Maybe is something for HCPF to talk about. What studies have been done now that we've had such relatively low uninsured rate for 7 years now, to what the impact is to community and to the economy by having instead of 15 to 20% uninsured, 6%. That would be really interesting. It's Rebecca, Jessica, Molly, I don't know if anybody knows, is HCPF or anybody studying what this has done? Because back in the day, we were saying if we could only have universal health insurance, our healthcare system would be a lot better. We all know it'd be a lot better, but it would be less expensive too. So that would be something interesting. Does anybody have any thoughts on that?
My initial thought is Colorado Health Foundation and Colorado Consumer Health Initiative. I know we got some good data from, I know they do the eligible but not enrolled report every year, but I don't know if that looks at the outcomes that you're speaking to. But I think that's who my first stop would be the Health Foundation. Or the Health Institute. That's what I was thinking of, not CCHI.
Yeah.
The Health Institute and the Health Foundation.
Yeah, absolutely. Yeah, you're right.
Rich, it's interesting. I was just talking with one of our assisters yesterday about this exact same thing and what they had observed personally and working on a grant that was, 10 years ago to serve people without insurance. And then the funding was gone because Medicaid had expanded and now people had coverage. And we talked a lot about, what's the impact going to be on chronic disease if people have better access to preventive care, for example. So yeah, super interesting. Wendy, I see you with a hand raised. Please chime in.
Yeah, I'm from Tri-County. I'm on Rebecca's team. And I also sit on the Performance Improvement Advisory Council for both HCPF and Colorado Access. And I would just say both are very, very concerned about the threats to Medicaid. And so they are directing funding. HCPF is directing funding to the RAE, and the RAE is being very supportive and sending funding out into the community to do a lot of community outreach around renewal. We're hearing often people just aren't going to open their mail. They haven't had to take action in the past. They get email from HCPF and it either scares them to get government mail and open it, or they've never had to take action before. And so the threats to Medicaid are so significant when the public health emergency ends. So I just wanted to draw attention to that. And I also, the timeline I shared in the link, there's a lot of coverage options coming, one of which is all children under the age of 18, regardless of documentation status, will be eligible for Medicaid in 2024. That's an example of the legislation that's linked in that visual. So I feel like HCPF is doing a lot to expand coverage. It's not always easily accessible, or sometimes there's more system barriers than there are ease of access. But lots of us, including lots of people on the call, are working on those system barriers. But, if we can address those, there's lots of expanded coverage around reproductive health, around children, 25% of the state is now covered by Medicaid. Half of those are children. So expanded coverage for children is just something we're really looking forward to. So hopefully we will not see the decline in Medicaid we're also worried about with the end of the public health emergency. But I think it's going to take all of us to get that word out and support community members that might have difficulty filling out the renewal application that's 34 pages long, front and back 17, only in English and Spanish. So knowing who these assistance sites are for help is really an asset for our community. So hopefully we can all spread the word and direct our community members to support when they need it.
All right. Well, thank you so much. Thank you to our speakers. Thank you everyone again for being here.